Hi everybody, I am Sam. If you're new to my channel, I make videos on neurodiversity and exploring the autistic experience every week here on YouTube. Today I'm going to be talking about high-functioning autism. This video has taken me so long to finish because I could just feel the hate seeping from the internet. But it's done now, thank goodness. Autism functioning labels is a topic where I am almost guaranteed to piss somebody off, but I wanted to cover it because it's kind of the elephant in the room when it comes to my channel, and it's an important topic. So let's discuss. The beady-eyed observers among you might notice that I never refer to myself as a high-functioning autistic person, even though I probably fulfill the criteria in everybody's imagination about what a high-functioning autistic person probably looks like. I am verbal, sometimes hyperverbal, I am hyperlexic, and my autism comes across as mild to people I meet. Unless they meet me in the middle of a meltdown, probably 90 or 95% of people wouldn't even think that I was autistic. And to most people, I'm just that. A highly functioning, mildly autistic person with just a touch of autism. I'm just really like a little bit quirky, right? So that's me on the one side over here, and on the other side of this alleged binary, there are many autistic people who are non-verbal, who struggle to do tasks or activities in everyday life, such as dressing themselves, using the bathroom by themselves, and appear more outwardly autistic and obviously autistic to other people. They might have additional struggles such as a comorbid learning disability, or maybe another health condition like epilepsy. Their lives are very different to mine. So I want to start by stating something that is pretty obvious to me. I do know that I'm not the same as these autistic people. I see the differences, I really do. We do present vastly differently, and I know that there are huge differences in terms of how we deal with everyday challenges and what those challenges might be. But by disagreeing with the concept of functioning labels, it doesn't mean that I'm saying that we're all the same. It's a spectrum, y'all. Don't do that. So by functioning labels, what I mean is that people will look at someone and say, oh, he's low functioning, he has severe autism. Or you're high functioning, you've got mild autism. And it happens a lot to me. They can't wrap their heads around the fact that I can be autistic and this other person can be autistic too, and actually it's kind of like the same thing even though we are so different. But the interesting thing about functioning labels is that they're not used in any diagnostic sense. And what I mean by that is you don't get diagnosed with high-functioning autism. It's something that the people themselves might call themselves, or their family members, or even medical professionals who will add it in at a later date to make sense of kind of like a narrative. What you actually get these days when you get a diagnosis is a level of your support needs. Now you might think that that's just another way of saying the same thing in like a, I don't know, PC way or whatever, but it is a subtle yet important difference. So there are 3 levels, and in this paradigm, even the mildest level of autism, level 1, is considered needing support. Level 2 indicates that you might require substantial support in your everyday life, and level 3 means that you require very substantial support. Now, I didn't actually get a level with my diagnosis, feel a bit left out, but I assume that level 1 is where I would have been placed. But think about the difference between saying, oh, she's very high functioning, isn't she? And oh, she requires support. And the reason these levels are so important, in my opinion, is it gets across that even the mildest, most high-functioning autistic person probably requires support in their everyday life. And that can be a hard thing for people to wrap their heads around, especially when somebody like me who was diagnosed in their 30s has been kind of like doing all right up until this point. There's a lot you don't see though. And also remember that some of the support that I might have got through my life has not been through full-time carers or medical professionals. It has been through family, friends, or my partner, and we might not have even realised how much support was being given at the time. I mean, my husband supported me for 10 years before we even knew why I needed so much support in doing everyday tasks and things in everyday life. So let's talk about how functioning labels came about in the first place. Well, it used to be a measure of IQ, basically, where a low-functioning autistic person is someone who has an IQ of below 70, and therefore a high-functioning autistic person is someone who has an IQ of 70 or above. So what we think of as low-functioning autism is actually kind of shorthand for autism plus comorbid intellectual disability. It wasn't a measure of the severity of their autism necessarily, but an indicator of additional disability, additional needs, additional support needs. And there are a lot of comorbid conditions that can make being autistic significantly more difficult, not just for the autistic person, but for their carers. But of course this means, on the flip side, being high functioning doesn't actually make you a genius. Nor is it based on any kind of measurement of your actual functioning in life. I mean, what does having an IQ over 70 actually tell you about a person's life, about their struggles? Or even an IQ over 140, what does that tell you about somebody's life? IQ is actually a pretty poor predictor of many things, including social skills, executive functioning, both of which are kind of crucial to getting anywhere in life. At this point, I'm going to talk about Asperger's, not because I particularly want to, but it is a very big topic, probably for another video. I say that a lot. But I kind of feel like I have to talk about it at this point. So Asperger's used to be the diagnosis you would get if you were otherwise autistic, but had no language delays and average to high levels of intelligence. Since 2013, Asperger's and other subdiagnoses of autism have all been lumped under the same category of autism spectrum disorder or autism spectrum condition. So Asperger's used to be considered the high-functioning or mild form of autism, but the American Psychiatric Association, in their most recent edition of the DSM, they revised it and they scrapped Asperger's as a diagnosis completely. The DSM is kind of like the diagnostic manual for mental conditions, so it's sort of like the Bible for psychologists or something. The reason they did this is because, well, it was getting a bit confusing because there were several subdiagnoses of autism, but more importantly, the essential parts of each condition were more or less the same. And furthermore, in studies they found that the same person might be diagnosed with different subdiagnoses depending on which professional they saw and presumably what their biases were. So you'd think if they were meaningful categories that actually were kind of like replicable, then the same person would get the same diagnosis, but this is not what they found, and that's why they ended up scrapping it. A lot of people objected to this change, and still do, but the working group that came up with these changes found that there wasn't actually a great deal of difference between the Asperger's group and the rest of the autistic population when it comes down to it, once verbal ability and intellectual disability had been accounted for. So all they had been doing was artificially separating autistic people according to intellectual ability rather than according to their real needs, their real struggles, or their actual real life functioning. By the way, for the record, I'm not here to tell you what you can call yourself. I know it can be hard to identify with a diagnosis and then have it like taken away or not exist anymore. So a lot of people cling to the term Asperger's. They call themselves an Aspie, and like that's fine, whatever. But autism is also not a dirty word, so you can use that too if you feel like you want to. I don't know, maybe that should be my new tagline, autism is not a dirty word. But I also think that we should give people a break if they call themselves an Aspie, because not everybody stays up to date with the developments of the DSM like I do. And it's not like they have a recall system for changing the name of your diagnosis, so if you were diagnosed with Asperger's syndrome, as far as you're concerned, that's what you got. And I don't personally like the term, I don't use it for myself because I wasn't diagnosed with it, but I'm not going to hate on people who use it, and I don't think any of us should, because that's not going to change anything. But enough about Asperger's. Let's get to the crux of why functioning labels hurt all autistic people. For so-called high functioners, labeling us in this way means that any struggle we have is dismissed as mild, and this kind of what about attitude, whataboutery, is rife. You know, what about the people who live in a home? What about the people who can't go to the toilet by themselves? What about them? You're not saying you're functioning like them, are you? And so when we experience depression, anxiety, burnout, suicidal thoughts, which are all far more common and much harder for us than a neurotypical experiencing these same things, it's not taken as seriously as it should be. I mean, I don't think anyone's mental health is taken as seriously as it should be, but autistic people are a very vulnerable population, whether we are high functioning or not. The term high functioning creates expectations that you are doing all right because you've just got a touch of autism, and you should just act like everybody else because it really can't affect you that much. I am now getting to the point where I'm very comfortable sitting here and talking to the camera, to the extent where I feel like on camera I'm becoming less and less visibly autistic. But let me tell you, my autism affects me every single day, and I have struggles every single day, even if I don't leave the house, because of it. So when people say, well, it's mild because it's just like, oh, you're just a bit sort of, I don't know, quirky or this or that, you're just a bit like, you're a bit weird. that doesn't even begin to touch on how autism affects me in my everyday life. And how it has affected me, and I didn't even realise it was autism, I just thought I was terrible at life. But if you look at it another way, if you're talking about the so-called low-functioning autistics, these labels are also problematic and harmful for them. Imagine being introduced to people by your caregiver or by your parent as, oh, this is little Jimmy, he has low-functioning autism. Implying that someone barely functions because they have particular struggles in certain areas of their life, I mean, I don't know how to tell you that's offensive if you don't already get it. Just because somebody can't go to the bathroom by themselves and might need assistance with that doesn't mean that they're low-functioning, and there are some very problematic elements where people with this sort of low-functioning severe autism are seen as somehow less human than other people. I think this is especially problematic when it comes to non-verbal people because they don't get the chance to stand up for themselves. And people often conflate non-speaking with non-understanding, which is not the case at all. It literally happens in different areas of your brain. But imagine hearing someone describe you like that your whole life. It would have a significant impact on your self-esteem and your own feelings about what you are capable of. But honestly, functioning labels don't really tell you much about a person's life, a person's abilities, strengths, or weaknesses, aside from this outside perspective of how hard this person really has it, or maybe things like whether they need a full-time carer. But it doesn't actually tell you anything about what their internal experience of life as an autistic person is. Let's flip it around a little bit. Imagine saying to somebody like, oh yeah, no, I don't have autism, I'm neurotypical, and somebody says, but are you a high-functioning or a low-functioning neurotypical? You must only be mildly neurotypical. I mean, that sounds really weird, right? But there are high-functioning and low-functioning neurotypicals because people function at different levels, regardless of whether they're autistic or not. But you wouldn't say it like that. You wouldn't say, are you a high-functioning diabetic or a low-functioning diabetic? Even though diabetes can have a drastic effect on a person's life, but you would just never say that. Mildly diabetic. What does that mean? Here come the doctors telling me that's the thing, right? It was just an analogy, it's probably a bad one. But being autistic or being neurotypical is so much more about than what people see on the outside. You know, it's like an iceberg, and sometimes mine looks very small from the surface, but that doesn't mean there's not a lot going on underneath, right? Although I have to say my iceberg is getting a little bit bigger these days. Now, I hope in this video that I haven't come across as unsympathetic to parents who spend their days caring for their autistic children. It's extremely tough to be a carer, and that's not my intention. I'm not here to fight or to tell you, you're saying the wrong thing, you bad person. And more importantly, you are doing incredibly important work that can indeed be thankless. But if you are really set on using functioning labels to describe your family members or your children, and this video has already started to get your back up a bit and you're ready to pounce with an internet comment, maybe just think about why it is that you're so set on using functional labels. And what actually are you trying to get across with it? What are you trying to communicate? I know it's ironic, an autistic person teaching a neurotypical person about communication, right? But think about it. Words have meaning, words are there to communicate. If you want people to know that you spend your days and nights caring for your child who is disabled and it is wearing you down, then tell people that you are a full-time carer to your children. You don't have to use the term low functioning to get across what you're actually trying to say. Which is that your life might be really difficult and you might need a break and you struggle with things in a way that nobody seems to get. But having people like me be included in the autism spectrum doesn't diminish what other autistic people go through. It doesn't have any impact on what they go through. We are all different. It is a spectrum, y'all. And it's not a competition. We can all exist in this space. Saying that people like me don't really have real autism is just creating, like, unnecessary divisions within an already divided community. But you know, also, if you want to call people high-functioning, if you say, oh, my friend, she's very high-functioning, because you see them as intelligent, not disabled, not disordered, and you see past their odder behaviours, then focus on their intelligence. And remember, autism is still not a dirty word. If you tell someone that your child is autistic and they see a thriving, happy child, then you can also start to shift their perceptions on what autism actually looks like sometimes, without downplaying their struggles. But remember, when you call somebody like me high-functioning, what it sounds like to us is that you don't see our struggles, therefore they don't exist, and it actually feels like you don't really see us at all. It's just an unnecessary term that doesn't really give you any indicator about how autism presents in that person or what they are in fact struggling with. And I know it's hard to have to ask every autistic person you ask, but That's far better than assuming how they're doing. Now, you might have noticed how in this whole discussion, nobody's ever talked about the medium functioning autistics, which, by the way, is honestly where I think most of us actually kind of lie. It's either high or low, you're fine or you're tragic. And this is, to me, a false dichotomy, because it's a spectrum, we're all over it. But the main reason that I think that sticking to these labels is very unhelpful and unnecessary is because autistic people do vary in functioning at different times in their life, and even at different times of the day. It's contextual, and I think environment and stresses play a huge role. Huge role. Taking myself as an example, if I'd been born into a different life, I think that my autism might have presented very differently and possibly would have been far more obvious as a child. The thing is though, I was privileged. I had a secure upbringing. I lived in the same house my whole life. I went to one primary school and one secondary school. I was extremely fortunate in that I got to go to private school where class sizes were very small, and my peers were not bringing issues related to poverty into the classroom. So distractions were minimal, I was able to concentrate on schoolwork. Even being in a class of 12 to 15 people was still a bit much for me, but I can't imagine how I would have coped in a class of more than 30 pupils. You know, I don't think I would have ever said anything, I would have struggled to concentrate, I probably would have just ended up looking out the window for most of it. So this was an accommodation that was beneficial to me before I knew that I even needed it or why I needed it. As another example, I had food aversions and a very restrictive diet as a child. But my family were able to afford the nutritious food I would eat or wouldn't eat. And they could afford multivitamins, doctor's appointments, that sort of thing. If I'd been born with less privilege into a life of poverty, perhaps trauma or abuse, as many autistic people do, then I guarantee my autistic traits would be far more obvious to you. Because my traits have always become more pronounced during times of stress. So for people who think that I'm high functioning because my autism is just somehow milder than others, I say to you, it is only because of the privileges that I grew up with that I can function in society as well, or not well, as I do. I think the reason that so many people dismiss or outright reject my diagnosis is because we have no common understanding of what an autistic person looks like in good mental health, with good support systems, and an autistic person who's basically thriving, what do they look like? When you see my autism as mild, what you are actually seeing is the result of having my needs met and accommodated. And these are general needs that will also benefit the neurotypical population, food security, financial security, this sort of thing. But then also more specific needs for autistic people, sensory accommodations, for example. But accommodating autistic people so that we get relief from symptoms, so that we seem less autistic, doesn't make us less autistic. It makes us happier. Now, I'm not telling you this to show off how lucky I've been. I'm telling you this because so many autistic people are not. They might live in poverty, with housing insecurity, with job insecurity, long-term unemployment, or abusive partners. The impact of a lifetime of chronic stress cannot be underestimated in autistic people who, by definition, are more sensitive than the rest of the population. I'm not trying to say that people with extremely obvious traits are that way because of trauma, because they're not usually. But I'm trying to get you to see that context and support can be the difference between a struggling autistic with poor mental health, who is actually barely functioning, and a thriving autistic. But the thing is, none of these things are to do with IQ and an arbitrary functioning label that you slap on 5 minutes after having met us. If you call somebody low functioning, you never allow for the possibility that they can thrive in their own way and they can live their life and be happy and successful in their own way and on their own terms. If you call somebody high functioning, you minimize their needs and their struggles, and actually it's just your perspective on how autistic they look, based on, behavior and outward appearance. I think with love, support and stability, all autistic people can thrive, but in our own way, and it might not be how you expect us to thrive. So let me know what you think of this video. If you enjoyed it, please leave a comment below, give it a thumbs up, and share it with other people who might need to hear this message. I hope you like this, and I will see you next time. Bye.